everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Niacin. Its brand name is Niaspan. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So niacin, or nicotinic acid, is a B-complex vitamin that has anti-hyperlipidemic effects. The exact mechanism of action is still not completely understood, although it may involve actions such as esterification of hepatic triglycerides, decreased release of free fatty acids from adipose tissue, and increased activity of lipoprotein lipase, which enhances the removal of chylomicron triglycerides from the plasma. Niacin has the ability to increase HDL, or high-density lipoprotein, decrease triglycerides, decrease LDL, as well as decreasing total cholesterol. So there are a couple different specific indications for niacin. The most common ones would be for dyslipidemias or hyperlipidemia. It can be used in combination with a bile acid binding resin to treat coronary atherosclerosis. It can be used to treat primary hypercholesterolemia. Niacin can treat severe cases of hypertriglyceridemia. Finally, it can also be used prophylactically in patients who have previously suffered from a myocardial infarction and also have dyslipidemias. Before somebody was to use niacin or Niaspan, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. It is contraindicated in patients who have active liver disease or unexplained persistent elevations in their liver transamidases. It's also contraindicated in patients who have an active peptic ulcer. Patients who have arterial bleeding can also not use doxepin. And the final contraindication would be for any individual that has a hypersensitivity to niacin. Moving on now to precautions, it should be used cautiously in individuals who have unstable angina or in individuals who are in that acute phase post-myocardial infarction. Would have to be even more careful if they're using niacin in these situations with other vasoactive drugs. Patients may notice an increase in fasting glucose. Some patients would require monitoring of this, especially if they're elderly or predisposed to diabetes. Some patients may experience an increase in uric acid, so it should be used cautiously in patients who have a history of gout. Reduction in phosphorus levels may occur, so for patients in whom this would be an issue, they would require more close monitoring. Healthcare professionals should be cautious when prescribing this medication to individuals who have a history of a peptic ulcer. An increase in prothrombin time may occur in some patients. They would be more at risk for this if they use other anticoagulants. These patients may also notice a decrease in their platelet count. They must also be used cautiously in patients who have a history of hepatobiliary disease or jaundice. Some patients may experience an increase in their liver tests, so when they're testing for those liver enzymes. Rhabdomyolysis has been reported with niacin in patients who are also using statins. Patients who have diabetes, renal failure, or uncontrolled hypothyroidism would be at a greater risk of this. And finally, it should also be used cautiously in patients who have renal impairment. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start using niacin, they can expect to take it in tablet form. When somebody is using niacin to treat coronary atherosclerosis, in combination with a bile acid binding resin, they can use 500 milligrams daily to start. They would then increase this dose by about 500 milligrams every 4 weeks to a maximum dose of 2,000 milligrams daily. The usual maintenance dose would be somewhere in between 1,000 and 2,000 milligrams daily. It's also important to note that with these doses, I'm talking about the extended release tablet. When somebody is using niacin to treat their mixed dyslipidemias, they can use the immediate release version of the tablet. Typically, they would start off using 250 milligrams daily. They would then increase the dose every 4 or 7 days until reaching a dose of 1.5 grams or 2 grams daily. This dose would typically be broken up throughout the day. If after 2 months of using this therapy, the patient still doesn't reach their dyslipidemia goals, they can then increase the dose in intervals of every 2 or 4 weeks up to 3 grams daily. Maximum dose in this situation would be 6 grams in 1 day. For individuals with hyperlipidemias who are using this medication after a heart attack, they would usually use 500 milligrams daily. would typically take their dose at bedtime, and if needed, they would increase their dose every 4 weeks or so until reaching a maximum dose of 2,000 milligrams a day. In this situation, they would usually be using the extended release tablet. Now, there are some side effects or adverse reactions that may happen to some patients when they're using niacin or Niaspan, so I'll list some of those here for you now. The most common side effect would definitely be flushing. This happens 88% of the time. 4 to 9% of patients experience nausea, and 2 to 9% experience vomiting. Some serious but rare side effects would be hepatic necrosis, hepatotoxicity, or rhabdomyolysis. That's all we're going to talk about today with niacin or Niaspan. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can do so by liking the videos, sharing the videos, and most importantly, subscribing to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.